topic for today is the liver transplantation, and we are looking at the indications for the same. So to start with some questions, the first question is the most common indication in case of children. So the second question is, what is the most common indication in case of the adults? So in this video, we'll find this answer to these questions and learn in detail about this topic. So to begin with, we first look at adults and their indications. So in terms of adults, what do we have? In terms of adults, there is a non-cholestatic. So non-cholestatic, if you see, what are the causes? It is about 65%. And what does it include? It includes the viral hepatitis B and the C. Next, it includes the alcoholic liver disease, and it also includes the cryptogenic. So all this forms 65% of the indications. Next, so this was non-cholestatic. Next, we'll go to the cholestatic. So under cholestatic, it includes, there can be the primary biliary cirrhosis. Next comes the primary sclerosing cholangitis. Then there can also be, this amounts to about 14%. Then comes the autoimmune. Autoimmune is about 5%. So let's just recap. So we dealt with the indications of liver transplantation and we are dealing with the adults. So here the non-cholestatic, it forms about 65%. Then comes the viral hepatitis B and C, and this is again a component of this. So it includes viral hep B and C, then alcoholic liver disease, as well as the cryptogenic. All this amounts to 65%. Then comes the cholestatic. Cholestatic amounts to about 14%, and this includes, there is a primary biliary cirrhosis as well as the primary sclerosing cholangitis. Then comes the AI. AI is for the autoimmune. Autoimmune contributes to about 5%. Then there are other minor causes. This can include, there is the malignant neoplasms, as well as the other miscellaneous causes. So miscellaneous causes amount to about 14%, and this malignant neoplasm amounts to about 2%. Then we'll be diving into the children. So in terms of children, the most common is the biliary atresia. So biliary atresia, it amounts to about 58%. Then comes the inborn errors of metabolism. The inborn errors, and this is of the metabolism. So this amounts to about 11%. Then we have the cholestatic. So cholestatic is about 9%. And what does it include? It includes the primary sclerosing cholangitis, as well as the Alagille syndrome. So let's just recap. So we're dealing with the adults. So under adults, the other two causes we left off with is the malignant neoplasm. It is one of the indication. It amounts to about 2%. And then there are also some miscellaneous conditions which amount to about 14% in case of adults. So that was about adults. And now we'll move on to the children. So in case of children, the biliary atresia, this is the most common, and it amounts to about 58%. And other things, it includes also the inborn errors of metabolism. This amounts to about 11%. Then when we look at the cholestatic, it amounts to 9%. And there is a primary sclerosing cholangitis, as well as it includes the Alagille syndrome. Next, we are moving on to the autoimmune. So what about the autoimmune? So if you see the autoimmune, it amounts to about 4%. This is all we are dealing with the children. So autoimmune is 4%. Then is the viral hepatitis. So viral hepatitis is about 2%. Next, the miscellaneous. The miscellaneous is about 16%. So to recap, we dealt with the children. So autoimmune 4%, viral hepatitis 2%, miscellaneous amounts to about 16%. Now we'll be answering our questions. So the question we asked was in case of adults. In case of the adults, what is the most common cause in case of adults? For indication for the liver transplant, it is the non-cholestatic. So non-cholestatic, it amounts about 65%. So it includes, there is viral hepatitis B and C. Then there is also the alcoholic liver cirrhosis. Then comes the cryptogenic. So all these are included in case of the adults. Whereas when we move on to the children, this was the second question we asked. The most common is the biliary atresia. So this biliary atresia, it amounts to about 58%. So let's recap. So we asked two questions. In case of adults, what is the most common indication? And in case of children, what is the most common indication? In adults, it is a non-cholestatic. So this amounts to about 65%. So it includes the viral hep B and C. It also includes the alcoholic liver disease cirrhosis and the cryptogenic. All this amounts to about 65% in case of the adults. In case of children, the most common is the biliary atresia. And this biliary atresia, it amounts to about 58%. So this was about the indications in the liver transplantation. So to learn and grow daily, please do subscribe.